Hi, I'm Dr. Shannon Staker. I'm a pediatrician at Uintah Basin Healthcare here in Roosevelt, Utah. Today I would like to talk to you about measles. Unfortunately, we're seeing a measles outbreak in Utah, and although we've been fortunate not to see measles here in the Uintah Basin yet, we're anticipating that we are going to soon. So we'd like to give you some information so that you can be aware of what you're looking for and how you can prevent measles. First of all, I want to start with just what measles looks like. Measles is an infection caused by a virus. Typically starts with a high fever, conjunctivitis or pink eye, a runny nose, and a cough. And then after about 3 to 5 days, a rash appears. The rash usually starts on the head and then spreads down to the rest of the body. Kids are pretty miserable and adults are pretty miserable with measles, but the worst part is that about 20% or 1 in 5 of patients who get measles will have to be hospitalized for complications. Those complications are usually pneumonia or something called encephalitis, which is an infection of the brain. Those are really scary complications, and we don't want to see them, and I think you don't want to see them either. So let's talk about how we prevent measles. Measles is preventable with a vaccine. Typically, the vaccine is given at 12 months of age, and then we give a booster dose at age 4 or 5. If you get 1 measles vaccine, you are 95% protected against getting the infection, and with 2, that makes you 97% protected, which was really effective. One of the difficult things about measles is that the virus that spreads it is highly contagious. It is spread both by contact and by respiratory. So if someone sneezes or coughs on you and they have measles, it's really likely that if you haven't been vaccinated that you will get measles. It can last in a room up to 2 hours after a patient's been there. And measles is so contagious, in fact, that if 10 unvaccinated people are in a room with someone who has measles, 9 of them will become infected. The people that are at highest risk for measles are infants, less than 2 years old, and particularly those less than 1 who don't have the option to be vaccinated yet, pregnant women, and people who are immunocompromised. And some of those get protected by the rest of us choosing to vaccinate. If you have any of those symptoms of measles, fever, conjunctivitis or pink eye, runny nose, cough, and especially if you find that you have the rash, it's really important that before coming to the hospital, you contact your physician's office so that they can be aware that you're coming and separate you from other patients who might be at risk for getting the disease. Please visit this link if you have questions about what the symptoms look like or how to schedule an appointment with your provider. Measles is a preventable disease. Even if you've been exposed to someone with measles, you can still get the vaccine up to 3 days after. If you have any questions about whether you've been vaccinated or any questions about the vaccine in general, please contact your provider. Please help us prevent the spread of measles.